Dr. Smith, Susan Thomas with Ivax Laboratories.
Hi, Susan.
We discussed the benefits of QVAR being formulated as a solution rather than a suspension, and today I'd like to share the patient-friendly benefits of Nazarel, which is also formulated as a solution.
Okay.
Dr. Smith, do you feel that all your patients consistently shake their nasal steroids and count actuations?
Oh, probably not, but I don't think it makes a huge difference with these kinds of drugs.
Well, it might, don't you think, since most of the nasal steroids are suspensions, and if they're not shaken before spraying, then subpotent doses or even superpotent doses can result. Isn't that the reason why they're labeled that way? Well, the reason I bring this up is that Nazarel is the only nasal steroid on the market that is a true solution. The active drug stays evenly distributed, and patients don't have to shake or count actuations. With Nazarel, they can be sure to get a consistent dose every time to the last drop. Now, this may enhance effectiveness as well as patient convenience.
Hello, Dr. Jones. Mike Metcalf with Ivax Laboratories.
So, Mike?
Last week, we discussed the superior benefits of QVAR versus the other inhaled corticosteroids. We reviewed these scintigraphy pictures from the Journal of Asthma and Clinical Immunology and discussed QVAR's superior lung deposition versus fluticasone. You brought up the concern that QVAR is not as potent. Now, why is that a concern for you?
Well, my only concern is that lung deposition does not equate to efficacy. And based on the data, fluticasone is a more potent molecule than beclomethasone.
When you say potency, are you referring to efficacy?
Oh yes, the more potent a product is, the more effective it is in treating a patient. Also, the more potent an inhaled steroid is, the fewer doses you'll need to treat the patient.
Appointment today to spend a few minutes discussing QVAR and how it can benefit your asthmatic patients.
Sure.
Dr. Perez, the last time I was here, you agreed that the small particle size of QVAR could be important in treating the small airways. Would you mind sharing with me why you feel that a drug with a small particle size like QVAR might have advantages?
Well, I guess it's possible that better deposition into the small airways may control the disease better, but I need to have some evidence before I'll prescribe it.